In a gripping display of political theater, Robert F. Kennedy Jr., the newly confirmed Secretary of the Department of Health and Human Services, took center stage in Washington, D.C., on Wednesday, May 14, 2025, for his first congressional testimony since assuming office. Facing relentless scrutiny in back-to-back hearings before the House Appropriations Committee and the Senate Health, Education, Labor and Pensions Committee, Kennedy defended his controversial vaccine messaging, sweeping agency layoffs, and a radical restructuring of the nation's health infrastructure. The hearings, centered on President Donald Trump's budget proposal, revealed deep divisions over Kennedy's leadership and sparked heated exchanges that captivated lawmakers, protesters, and the public alike. The spotlight fell hardest on Kennedy's vaccine stance, particularly amid the deadliest measles outbreak in decades, with over 1,000 cases and 3 deaths, including 2 unvaccinated children in Texas. Democrats seized the moment to challenge what they called Kennedy's doublespeak on vaccines. Senator Chris Murphy, Democrat Connecticut, accused Kennedy of undermining public trust by questioning the measles vaccine's safety and efficacy. "You told the public the vaccine wanes very quickly. You said on the Dr. Phil show it was never fully tested for safety. You claimed there's fetal debris in it," Murphy charged. Kennedy, raising his voice, shot back, "All true. Do you want me to lie to the public?" Murphy swiftly countered, "None of that is true," highlighting the scientific consensus that the measles, mumps and rubella, MMR, vaccine is 97% effective with 2 doses and rigorously tested. House Appropriations Ranking Member Rosa DeLauro, Democrat Connecticut, was equally scathing, accusing Kennedy of promoting quackery and failing to contain vaccine-preventable diseases. When Representative Mark Pocan, Democrat Wisconsin, pressed Kennedy on whether he would vaccinate his own children against measles today, Kennedy hesitated before responding, "Probably." He sidestepped questions about polio or chickenpox vaccines, insisting, "My opinions about vaccines are irrelevant. I don't think people should be taking medical advice from me." This evasive stance drew sharp criticism, especially given Kennedy's history of vaccine skepticism and his earlier admission that he vaccinated his now-adult children but regretted it. Public health experts have warned that Kennedy's mixed messaging risks further eroding trust in vaccines at a critical time. Beyond vaccines, Kennedy faced intense questioning about his drastic overhaul of HHS, which included laying off 10,000 employees and offering deferred resignation to another 10,000. He defended the moves as necessary to streamline an agency he claims ballooned during the COVID-19 pandemic. "We had to act quickly," Kennedy told Senator Andy Kim, Democrat New Jersey, admitting some cuts were mistakes but arguing decisive action was paramount. However, his grasp of the details appeared shaky. When Senator Lisa Murkowski, Republican Alaska, raised concerns about delays in domestic violence prevention funding, Kennedy seemed unaware, stating, "My understanding is that the funding was not cut." Murkowski pointed out that layoffs likely left no staff to process funds, exposing gaps in Kennedy's oversight. Kennedy also clarified that the layoffs were his decision, though informed by recommendations from Elon Musk's Department of Government Efficiency, DOGE. "I pushed back on certain cuts and canceled some," he said, denying that entire HHS offices were eliminated. Instead, he claimed some functions were being shifted to a new Trump administration entity, the Administration for a Healthy America. Representative Lois Frankel, Democrat Florida, pressed Kennedy on the 10,000 employees on administrative leave, questioning if they were being paid to do nothing. Kennedy insisted, "We want them working," but struggled to clarify their roles, fueling perceptions of disarray within HHS. Republicans, while generally supportive of Kennedy's Make America Healthy Again agenda, weren't shy about raising concerns tied to their constituents. Representative Chuck Fleischmann, Republican Tennessee, grilled Kennedy on the cost of phasing out artificial food dyes, a Kennedy priority, noting estimates that finding substitutes could be 5 to 10 times more expensive for snack food manufacturers in his district. Fleischmann sought collaboration to balance safety and economic impacts. Similarly, Representative Riley Moore, Republican West Virginia, demanded assurances that the National Institute for Occupational Safety and Health, NIOSH, programs, including those supporting coal workers in his state, would be fully restored after earlier layoffs. Kennedy agreed to work with both, signaling a willingness to adjust his plans under pressure. The hearings marked Kennedy's first appearance before Senator Bill Cassidy, Republican Louisiana, the Senate Help Committee chair who played a pivotal role in his confirmation. Cassidy, a physician, had secured promises from Kennedy to avoid undermining vaccine policy, but took a softer tone on Wednesday. He refrained from directly questioning Kennedy on vaccines, instead urging him to provide direct reassurance to Americans about HHS reforms. However, Cassidy did correct Kennedy's false claim that only the COVID-19 vaccine was tested against a placebo, noting that rotavirus, measles, and HPV vaccines underwent such trials. The exchange underscored ongoing tensions between Kennedy's rhetoric and established science. The hearings weren't without drama. Protesters disrupted the Senate session, charging toward Kennedy while shouting, "RFK kills people with AIDS," before being escorted out by Capitol Police. The outburst reflected broader public unease with Kennedy's leadership, particularly among health advocates who fear his policies could jeopardize critical programs. Meanwhile, Kennedy stood firm on Trump's budget proposal, which calls for a 26% cut to HHS's $127 billion discretionary budget, including $18 billion from the National Institutes of Health and $3.6 billion from the Centers for Disease Control and Prevention. He argued these reductions would save $1.8 billion annually and refocus HHS on chronic disease prevention. But critics, including Senator Bernie Sanders, Democrat Vermont, warned the cuts threaten medical research and public health infrastructure. Kennedy's testimony laid bare the challenges of his tenure, balancing a controversial past with the demands of leading a sprawling federal agency, appeasing both vaccine skeptics and a public reliant on science, and navigating a polarized Congress. As the measles outbreak worsens and HHS faces unprecedented upheaval, Kennedy's actions will remain under a microscope. For now, his combative defense of his vision signals a turbulent road ahead for America's health policy.